Semen analysis is important in numerous instances in medico-legal practice. In indications is civil and criminal. In civil, there is any disputed paternity, legitimacy, artificial insemination, compensation on ground of acquired sterility or failure of vasectomy, divorce, non-ejaculation amount to impotency. Criminal, sexual offences, rape, bestiality, sodomy, buccal, coitus, adultery, identification of accused, collection, masturbation, vaginal swab or swashing, wet swab from dried stains on body, wet swab from dried stains on body, cutting and drying stained piece of cloth, cutting or plucking matted pubic hair, scraping with a sharp instrument, dried stains on smooth impervious surface. Examination, appearances, pale white or greyish white, thick viscid fluid with a characteristic odor, fresh seminal fluid, greyish white or yellow grey glistening with an irregular map-like outline, dried stain. Loss of viscosity makes it thin on standing. Loss of viscosity makes it thin on standing. Cloth stiffen as if scratched. Fluorescence of a bluish white color under UV light. That is appearances. Quantity, 4 to 5 milliliter ejaculation after a period of abstinence. Reaction, alkaline. Then chemical reactions. First one is Florence test. Procedure, extract seminal stain using 10% HCl and a drop is placed on a glass slide and is allowed to dry. Place a cover slip on slide and allow a drop of fluorescent solution, that is 1.65 gram of potassium iodide and 2.54 gram of iodine in 30 ml distilled water to run under cover slip. Inference, dark brown large rhombic crystals of choline iodide arranged in clusters, roses indicates presence of seminal fluid. Medico-legal importance, test is of negative value. Presence of crystals indicates presence of some vegetables or animal substance, but its absent rule out a seminal stain. Okay. Next is Barberio test. Procedure, place extract of dried seminal stain on a glass slide, cover it with a cover slip, add a drop of saturated aqueous or alcoholic solution of picric acid. Inference, yellowish, long, needle-shaped crystals of spermine picrate, that is Barberio, indicates presence of seminal fluid. In this, what will you form? In this, crystals of choline iodide, in this spermine picrate, choline iodide and spermine picrate. Acid phosphatase. Procedure, blotting paper dipped in seminal fluid is sprayed or treated with alpha naphthyl phosphate and fast black potassium dye. Inference, purple color indicates acid phosphatase. Has been replaced by prostate specific antigen. This acid phosphatase test is replaced by prostate specific antigen. Creatine phosphokinase levels more than 100 units per ml is diagnostic of semen. Medico-legal importance is can dictate even 6th month old seminal stain. That is a specialty of creatine phosphokinase. Next is immunological method. Dictate human antigens like MHS5 produced by seminal vesicle, monoclonal antibody 4E6 on spermatozoa and in ejaculated fluid, prostate specific antigen or P30 produced by prostate reliable choline and spermine test. Dictate unique combination of choline and spermine which is present only in semen by thin layer chromatography technique. Next is ammonium molybdate test. Procedure, ammonium molybdate is added to a seminal stain. Inference, deep yellow color from presence of phosphorus. What is phosphorus? So what are the tests? Florence, Barberio, acid phosphatase, creatine phosphokinase, immunological method, colon and spermin test, ammonium molybdenate test. Then what? Microscopic examination, demonstration of a spermatozoa procedure. Seminal stain is subject to a few drops of 1% hydrochloric acid or 3% acetic acid for half to 1 hour in case of fresh stain, or 2 to 4 hours in case of old stain. Slides are prepared by rubbing or scraping central area of stain onto a slide. Films are dried in air or fixed in ethyl or methyl alcohol for 1 minute, stained with methylene blue for 15 to 30 minutes, and counter stained with eosin for 2 minutes. Inference: the spermatozoa appear as a deep red or pink, anterior 1/3 to 1/3, and faintly stained or unstained posterior half or 2/3. Demonstration of motility procedure: a drop of vaginal mucosa is placed on a glass slide diluted with a drop of normal saline for examination of a motile spermatozoa under microscope. Inference: motile sperms are seen up to 6 hours and rarely 12 hours after ejaculation into vaginal lining. Proof of semen: finding at least one unbroken spermatozoa. Absolute proof. Detection of electrophoretic LHD isoenzyme of sperm. Absolute proof. Okay. Characteristic fluorescence in UV light, positive precipitin test, high level of acid phosphatase, high level of creatine phosphokinase, detection of P30, that is prostate specific antigen. Thank you.